Compression therapy is the standard of care for venous leg ulcers, lymphedema, and lymphedema. And also, there's current research that it may be useful in the prevention of post-thrombotic syndrome also. Because of this, several interest groups emerged specific to promote evidence-based medicine on the benefits and standards for compression therapy. So chief among these groups are two. Number one is the International Compression Club and the Center of Interdisciplinary Research on Compression, or CERC. So the ICC was started in 2005 by Dr. Hugo Parch. He is a dermatology and angiology specialist. He was also the past president of the Austrian Society of Angiology and the International Union of Phlebology. So currently it has 300 international members for various chapters. CIRC, CIRC is one of the newer compression therapy groups. It was started in 2010. Currently, it's headed by Dr. Attilio Cavezzi, who is the current chair. He is also the author of our Black Book on phlebo-lymphedema. Going on to the actual compression modalities that we use, we're all familiar with the bandages and stockings, and yes, there have been some improvements. First of all, let's discuss the bandages. So we all know that the bandages are the mainstay of the intensive phase of decongestion. And of course, short stretch bandage is preferred. But surprisingly, we now have a brand that promotes very short stretch bandages. This is the picture of the very short stretch bandage. It looks and feels just the same as a short stretch bandage. This table lists down the differences in the materials that are used in the very short stretch versus short stretch bandages. So you can see that the lengthwise extensibility is now at 45% instead of 90% for the short stretch. So in the real world scenario, how do we use this? Personally, I use this for my patients with leg or arm lymphedema who are challenged in terms of bandaging. It's either they have no one at home to do their bandages for them, or they have a difficult time getting the correct manner of bandage usage. So when you use a very short stretch bandage on these patients, the patient is able to stretch the bandage to its full extensibility without sacrificing the correct compression. Also, very short stretch bandage I use for leg lymphedema that is a little more fibrotic than the short stretch bandage. Cost-wise, they are almost the same.